A very good morning, dear students. Today in this video lecture, we are going to study about health system. Now let's move on to health system definition. Health system can be understood in many ways. The World Health Organization defines health system as all the organizations, institutions, and resources that are devoted to producing health actions. This definition includes the full range of players engaged in the provision and financing of health services, including the public, non-profit, and for-profit private sectors, as well as international and bilateral donors, foundations, and voluntary organizations involved in funding or implementing health activities. Health systems encompass all levels: central, regional, district, community, and household. Health sector projects engage with all levels and elements of the health system and frequently encounter constraints that limit their effectiveness. The World Health Report 2000 identifies the four key functions of health system: stewardship, often referred to as governance or oversight; financing, human and physical resources; organization and management of service delivery. Next slide illustrates the relationship between the four functions of health system. Functions the system performs: stewardship, oversight, creating resources, investment, and training; financing, collecting, pooling, and purchasing; delivering services, provisional; stewardship. The stewardship or governance function reflects the fact that the government, particular in called upon to play the role of a steward because it spends the revenue that people pay through taxes and social insurance. And because government makes many of the regulations that govern the operations of health services in other private and voluntary transactions. The government exercises its stewardship function by developing, implementing, and enforcing policies that affect the other health system functions. WHO has recommended that one of the primary roles of a Ministry of Health is to develop health sector policies with the aim of improving health system performance and promoting the health of the people. Government have a variety of so-called policy levers they exercise to affect health programs and health outcomes. Government policies and health programs. Governmental policies lever relevance to health programs. The size of the total government health budget sets the overall limit on what a government can spend. Financing mechanism for funding the healthcare system determine what flexibility the government has for financing healthcare and identify potential financial barriers that may exist for assessing care. Allocation of the government health budget reflects how the government uses its tax resources to, for example, deliver service, employ staff, subsidize providers, regulate the sector, provide information, and configure the sector in terms of preventive versus curative services, personal versus supply, investment in human resources versus physical resources, affect which programs are prioritized and what populations will benefit. Government policy levers relevance to health programs, regulation of civil society organizations can facilitate or constrain the functioning of private voluntary organizations, non-governmental organizations, and community organizations with regard to service delivery and the capacity such groups have to influence and advocate for health services. Political support to raise awareness for specific health message and behavior can be powerful for stigmatized or polemic health initiatives and promoting high impact health interventions. Adoption of specific health standards or guidelines. Can improve the quality of care, expand or constrain the number of providers, and facilitate implementation of approaches such as integrated management of childhood illness, regulation of pharmaceuticals can improve medicine quality assurance and rational use of medicine. Can influence the ability to bring medicines and supplies into the country. Business regulation and taxation can influence the degree to which the private sector participates in healthcare. For example, import taxes can affect pharmaceutical sales. Business regulations can hamper private providers from setting up practices. Limitations on advertising can limit promotion of brand health products. An example of strong government stewardship in health can be found in Uganda, where the government's proactive approach to preventive HIV/AIDS is likely to have reduced the incidence of the disease. The government provides an enabling environment by encouraging community-based initiatives and supporting mass communication campaigns which promoted prevention and behavior change. Furthermore, stewardship in health encompasses activities that go beyond the health system to influence the main determinant of health. Example is education, poverty, environment, and other issues that are external to the health system but which either foster or constrain its effectiveness. For example, a government may decide to tax imported medicine to increase general tax revenue or to protect local producers, but in doing so will increase price to consumers and impair access to this medicine. Stewardship in this area seeks to influence the broader environment in which the health system operates. Emerging research evidence demonstrates that health is a key component to good development policies. The presence of poor health conditions in a country slows economic growth directly as societies lose potential workers and consumers to disease and disabilities. Attention to reducing Emerging research evidence demonstrates that health is a key component to good development policy. Saunders, 2004. The presence of poor health conditions in a country slow economic growth directly as society to potential workers and consumers to disease and disability. Attention to reducing child mortality and morbidity results in healthier children who can attend school and eventually contribute to economic growth when they become wage earners. Priorities in health policies also need to be elaborated at the national and local levels through health goals that addresses improving the health of the poor and reducing the gap between the poor and non-poor for an impact on child survival. Although the establishment of policy lays an essential foundation for a government's intentions, its value depends on the evidence and effect of policy implementation. As such, health system assessment should take account of the degree of government decentralization and the level and authorities that are the key decision makers in health, which levels have authority over planning, budgeting, human resources, and capital investment. Is the health sector represented at the district council level? Does the district have a role in policy development, resource allocation, and human resource planning? These dimensions underscore the need to approach health system performance and strengthening by understanding the interactions and linkage that exist between health financing service delivery and management of human resources in the health sector. We will study about the performance criteria in our next lecture. I hope you like the video. Please share and subscribe the channel.